Nerves. Published by WordPress.com. Radial nerve injury, anatomy, course, and clinical presentation. Root values. C5, C6, C7, T1. Origin and termination. Origin, posterior cord of the brachial plexus. Termination, lateral epicondyle, where the radial nerve splits into motor, pin, and sensory, superficial radial branches. Course of the radial nerve. 1. Axilla, upper arm. The nerve travels medially behind the axillary and brachial artery. 2. Middle arm. It runs in the spiral groove with the profunda brachii artery. 3. Lower arm. Passes laterally between the brachialis and brachioradialis muscles. The posterior interosseous nerve, pin, pierces the supinator muscle and turns around the radial neck to the posterior compartment, between the superficial and deep muscles. And 4. Superficial radial nerve. Travels under the brachioradialis along the lateral forearm until the lower third, where it turns backwards and divides into 5 dorsal digital branches. Radial nerve branches and function. Superficial radial nerve, sensory. Provides sensation to the lateral 2/3 of the dorsum of the hand, dorsum of the first web space, and the lateral 3 fingers. Motor, none. Posterior interosseous nerve, pin. Motor. Innervates the long extensors of the wrist and fingers, except for the anconeus. Responsible for wrist and finger extension. Main radial nerve motor branches. Triceps, lateral head. Anconeus, brachialis, lateral portion. Extensor carpi radialis longus, ECRL. Brachioradialis. Sensory. Lower lateral arm cutaneous nerve. Posterior cutaneous nerve of the arm and forearm. Modes of radial nerve injury and effects. 1. Axilla injury. Cause, compression or trauma, e.g., crutches, humeral fractures. Saturday night paralysis. Effects, weakness in triceps, brachioradialis, anconeus, and ECRL. Sensory loss in the lower lateral arm. 2. Spiral groove injury. Cause, compression, e.g., humeral fractures, improper positioning during surgery. Effects, wrist drop, weakness in triceps, lateral head, ECRL, brachioradialis, and long extensors of the fingers. 3. Posterior interosseous nerve, pin, injury. Cause, proximal radius fractures, compression of the supinator muscle. Effects, loss of extension in fingers and wrist, finger drop, wrist drop, with intact sensory function in the hand. And 4. Superficial radial nerve injury. Cause, lacerations or blunt trauma, e.g., cut wound at the back of the wrist. Effects, loss of sensation on the dorsum of the hand and fingers, but motor function remains intact. Deformities associated with radial nerve injury. Wrist drop. Loss of wrist extension, commonly seen in spiral groove or pin injury. Finger drop. Loss of finger extension, typically resulting from pin injury. Triceps weakness. Inability to extend the elbow fully, especially if the lateral head of the triceps is affected. Common causes of radial nerve injury. Trauma. Fractures, especially of the humerus, or dislocations. Compression. By crutches, crutch palsy. Improper positioning during surgery, e.g., operation table palsy. Iatrogenic. During surgical procedures, especially in the axilla or spiral groove. Prolonged pressure. Caused by improper arm positioning during sleep or extended immobilization. Management and treatment. Conservative. Splinting to prevent wrist drop. Physiotherapy for strengthening and functional recovery. Surgical. Nerve repair, particularly for significant nerve damage, or if there is a delay in recovery after 6 to 12 months. Tendon transfers for functional restoration when nerve recovery is unlikely.